Assalamu alaikum and very good morning to all of you. Today I am going to discuss IV fluids types. 0.9% Namas line. Its composition is sodium chloride 9 gram per liter, sodium 154 millimole per liter and chloride 154 millimole per liter. 0.9% Namas line uses dehydration, hypovolemia, hemorrhage, sepsis, mild sodium depletions. Cautions: heart failure, pulmonary edema, and renal impairment. Dextrose 5% in water. It is available in 500 and 1000 ml. Composition of dextrose 5% water, dextrose water, glucose 50 gram per liter. Uses: hypoglycemia, insulin shock, nutritional support, used to treat hypernatremia. Cautions: avoid to use for fluid resuscitation because hyperglycemia can result. Avoid in patient at risk for increased ICP as it can cause cerebral edema. Lactated Ringers 5% dextrose in water. It is available in 500 and 1000 ml. Other names: Ringer Lactate, Altman solutions. Composition of D5-LRS, sodium 130 MEq per liter, potassium 4 MEq per liter, calcium 3 MEq per liter and chloride 109 MEq per liter. Uses: dehydration, sodium depletion, replace GI tract fluid losses, patient with metabolic acidosis. Cautions: liver disease, lactic acidosis, heart failure, renal failure. Ringer solutions. It is available in 500 and 1000 ml. Composition of Ringer solution: its content is similar to lactated Ringer solution but does not contain lactate. Indications are the same for lactated Ringers but without the contraindication related to lactate. Hypertonic solutions: 0.45% sodium chloride. Other names: half strength Narmas line, half Narmas lines. Composition is sodium 77 MEq per liter, chloride 77 MEq per liter and dextrose water. Uses: used for replacing water in patients who have hypovolemia with hypernatremia. Cautions: excess use may lead to hyponatremia due to the dilution of sodium. 0.33% sodium chloride. Composition of 0.33% sodium chloride, dextrose water, sodium 56 MEq per liter, chloride 56 MEq per liter and glucose 50 MEq per liter, 170 kilocaloric per liter. Uses: used to allow kidney to retain the needed amount of water and is typically administered with dextrose to increase tonicity. Cautions: heart failure, renal insufficiency. 0.225% sodium chloride. Other names: 5% dextrose in 0.225 sodium chloride. Composition of 0.225% Namas line, dextrose water, sodium 38 MEq, chloride 38 MEq per liter and glucose 50 gram per liter. Uses: used as a maintenance fluid for pediatric patients, used together with dextrose. Hypertonic solutions: 3% sodium chloride. Composition of 3% sodium chloride, sodium 513 MEq per liter and chloride 513 MEq per liter. Composition of 5% sodium chloride, sodium 855 MEq per liter and chloride 1710 MEq per liter. Hypotonic sodium chloride. Uses: Severe hyponatremia, patient with cerebral edema, used as a diuretic therapy to assist in fluid excretion. Cautions: infused at a very low rate to avoid the risk of overload and pulmonary edema. Hypertonic dextrose solutions comes in three forms: dextrose 10% in water, dextrose 20% in water, and dextrose 50% in water. Dextrose 10% in water. Composition: dextrose water, glucose 100 gram per liter, 380 kilocaloric per liter. Uses: used in the treatment of ketosis of starvation and provide calories. Cautions: should not be infused using the same line as blood products as it can cause RBC's hemolysis. Dextrose 20% in water. Composition of dextrose 20%, dextrose water, glucose 200 gram per liter. Uses: act as osmotic diuretic that causes fluid shift between various compartments to promote diuresis. Dextrose 50% in water. Uses: its composition is dextrose water and glucose 5 gram per liter. Uses: used to treat severe hypoglycemia. Administered rapidly via IV bolus.